Hello, and welcome to my health and wellness channel. I'm Dr. Gauri Bhede, and I'm a medical oncologist. As we have lived through a stay at home lockdown and searched for ways to keep our health above the wellness line, I've explored the tools we have at our disposal. I've done a series on vitamins and minerals, which you can find here. Thinking of wellness habits took me back to my childhood when it was routine for my grandfather and granduncle to take a short walk after dinner each night. There is a special word for this in my language called Shata Pauli, meaning 100 steps. It didn't need to be a vigorous or a long walk, but it was deemed to be excellent for digestion and good health. Both of them lived to be in their late 80s and stayed in excellent health. I also remember being in Sevilla in Spain a few years ago. We had finished dinner with friends and were walking back to the apartment. The plazas were filled with families taking their post dinner strolls. It was almost midnight, but then they have late dinners. In the era of the COVID 19 lockdown, getting exercise became more challenging, but more important both for mental health and for physical health. When possible, people started walking more, and often we ran into neighbors and engaged in socially distanced conversations, which became our only social interaction. I'm going to show you some data that post dinner walks are also good for blood sugar control, in addition to this social benefit. That became important as a lot of people were working from home and cooking more. Comfort foods became very popular. People posted their creations on social media, and I found a profusion of posts about baked goods and fried foods. Stores in my neighborhood ran out of flour and yeast as baking bread became a comforting pastime. People made elaborate meals that they didn't have time to prepare in the pre lockdown days. When we enjoyed some of the delights of the kitchen, some of us felt that this translated into extra weight. Unfortunately, this became a big challenge for people who had pre-diabetes and diabetes, as most of the comfort foods also had a high glycemic index. I will provide some more information about the glycemic index of foods in a little while. Now, I'm not a doctor who specializes in diabetes management, but I do live with someone who has diabetes, so I'm acutely aware of how challenging it is to maintain control of blood sugars and finding the right foods to eat, especially for those who have type 2 diabetes. Type 1 diabetics don't produce insulin, so they're already on insulin replacement, sometimes several times a day or sometimes on a pump, and so they give themselves extra insulin if they need it. Type 2 diabetics produce insulin, but their tissues have become less responsive to insulin's action. They take pills to improve blood sugar control, and they try to avoid carbs and sugars and sweets. They exercise to reduce fat and to improve insulin sensitivity. This is a multi pronged effort to improve their sugar control and avoid going on insulin and delay any ill effects of diabetes. Memories of those post dinner walks piqued my interest in studies that have been done which show the benefit of improved sugar control in type 2 diabetics. Dr. Loreto Di Pietro, chair of the Department of Exercise Science at the George Washington University School of Public Health and Health Services, conducted an innovative study using whole room calorimeters. These were closed rooms which could measure various metrics of energy consumed and expended. Participants spent three 48-hour periods in the small calorimetric rooms and ate standardized meals. Their blood sugars were monitored continuously using blood tests. On the first day, they had a control period with no exercise. On the second day, participants either walked at a moderate pace on the treadmill for 15 minutes after each meal or for 45 minutes in either the late morning or before supper. The researchers observed that the evening post meal walk was the most effective in lowering blood sugar for a full 24 hours. Sherry Kohlberg and colleagues at a research university in Virginia conducted another study on patients with type 2 diabetes. Participants were either on diet or on pills to control their blood sugar. They consumed a standardized dinner with a moderate glycemic effect and had 2 exercise days in which they undertook 20 minutes of self paced treadmill walking immediately before or 15 to 20 minutes after eating. 20 minutes of self paced walking done shortly after meal consumption resulted in lower plasma glucose levels compared to values when subjects had walked before dinner. So, this study also concluded that post meal walking may be more effective at lowering the glycemic impact of the evening meal in individuals with type 2 diabetes compared with pre meal walking or no exercise, and may be an effective means to blunt post meal glycemic spikes. Why does this help? After a meal, glucose levels in the blood rise. To regulate such a spike, the body secretes insulin, which then lowers the blood sugar. If you have type 2 diabetes, you have insulin resistance in your body, and your body cannot adequately regulate your blood sugar. And when unregulated, spikes in the blood sugar can damage blood vessels. Post meal high blood sugar is an established cardiovascular risk factor. Oxidative damage resulting from such glucose spikes is a factor in development of diabetic complications. These spikes may be moderated by exercise. When you walk immediately after a meal, the excess blood sugar gets utilized in energy production, blunting the spike. As promised, we were going to talk about the glycemic index of foods. What is the glycemic index? The glycemic index is a number. It gives you an idea of how fast your body converts carbohydrates in your food into glucose. The higher the glycemic index, the more quickly the sugar will be absorbed and released into the blood. Those foods with a low glycemic index, on the other hand, will be digested more slowly and therefore release their energy much more slowly. Two foods with the same carbohydrates can have different glycemic index numbers. The glycemic index of each food can also change depending on how it is cooked, what it is cooked with, or if it's a fruit, how ripe the fruit is. For example, an overripe banana has a higher glycemic index than one that is not so ripe. A number of 55 or less is good, number of 70 and higher is bad, and in between it's okay. For a diet with a lower glycemic load, do eat more whole grains, nuts, legumes, fruits, vegetables without starch, and other foods with a low glycemic index. Do limit foods with a high glycemic index like potatoes, white rice, and white bread. Do restrict sugary foods like candy, cookies, cakes, and sweet drinks. You can still eat foods with a high glycemic index, just enjoy them in smaller portions and combine them with low glycemic index foods when you do. Here is a list of the glycemic index of foods that I obtained from the Harvard Medical School publishing website. As you can see here, corn tortillas are far better than wheat tortillas or rotis, and barley is the best grain. Most breads have a high glycemic index, no surprise, but I was surprised to see that the glycemic index of couscous was also quite high. The best breakfast foods seem to be rolled oats porridge and muesli. Raw apples appear to be the best, which goes along with an apple a day keeps the doctor away. And raw watermelon appears to be the worst. As expected, starchy vegetables have a high glycemic index. Dairy products, beans and lentils seem to be pretty good for you. And chocolate seems to be better than potato chips. I hope you found this information useful. Do hit the like button and subscribe to my channel for more interesting and useful information coming your way. Take care and be in good health.